Welcome dear students. Now let us move on to the next major section of ENT, and that is nose. So conventionally, let us begin by studying the anatomy of the nose. The topic of nose is comparatively easier than ear. Okay. So nose is divided into external nose and internal nose. First, let us learn about the external nose. Anatomy of external nose. The external nose is a pyramidal structure. It is made up of bone and cartilage. The osteocartilaginous framework supports the external nose. And the upper part of the external nose, that part which joins it to the forehead, is called as the root of the nose. And the base of the pyramid consists of two openings called as nares or nostrils, anterior nares or nostrils. Let us quickly write all of this. The external nose is a pyramidal structure. It consists of an osteocartilaginous framework. The osteocartilaginous framework can be further divided into upper 1/3 and lower 2/3. Because the upper 1/3 is bony. Upper 1/3 is bony and the lower 2/3 are cartilaginous. In the bony part, it mainly consists of paired nasal bones. There are two nasal bones, one on each side, the left nasal bone and the right nasal bone. And these two nasal bones articulate with the nasal process of the frontal bone in the midline, in the center. So that is the second structure. Nasal process of frontal bone. And the two nasal bones on either side are supported by the frontal process of maxillary bone. On either side there is the frontal process of maxillary bone. So all in all, we have three bones: the nasal bone, frontal bone and maxillary bone, one on each side. The nasal process of frontal bone is not paired, it is a single structure in the midline. Let us look into a picture for better understanding. As you can see over here, these two are the nasal bones. And in the center, in the midline, extending from above this is the frontal bone. It sends down a process over here, and that is called as the nasal process of frontal bone. That also contributes to the bony framework. And on either side, supporting the nasal bones, is the frontal process of maxilla. This entire bone is maxilla. And over here we have the frontal process of maxilla supporting the nasal bones. So these three constitute the bony framework. And next, moving on to the cartilaginous part. The cartilaginous part of external nose is made up of 4 cartilages. And those 4 cartilages are: first one is upper lateral cartilage. They are paired, so actually there are two upper lateral cartilages, and then we have lower lateral cartilages. The lower lateral cartilages are also known as alar cartilages. And then we have Lesser alar cartilages. The lesser alar cartilages are also known as sesamoid cartilages. And finally, we have a single unpaired septal cartilage in the midline. The first three are paired and septal cartilage is single. So let us study about each one of them in detail. Coming back to the picture, the uppermost structure seen here, this is the upper lateral cartilage and we have one on each side. This is upper lateral and this is the lower lateral cartilage, also known as alar cartilage. And in the midline that we see here, extending from the nasal bone to the tip of the nose, just a minor contribution, that is a single unpaired septal cartilage. And there is another cartilage. You can see here, this cartilage is known as the lesser alar cartilage. Now please understand that these three are paired and septal cartilage is unpaired. A few more things to be known about these cartilages. The upper lateral cartilage extends from the undersurface of the nasal bone from here to the upper border of the alar cartilage. And the upper lateral cartilage, the lower border, its lower border in the inside of the nose, internally, it forms a structure known as Lyman nasi or nasal valve, also called as Lyman vestibuli. And that is clinically important. So let me quickly write down. The lower border of upper lateral cartilage internally forms a structure that is known as nasal valve or Lyman nasi. Or it is also known as Lyman vestibuli. Lyman vestibule or Lyman vestibuli. The upper lateral cartilages of each side fuse with each other and also with the septal cartilage and the midline. And next we have is the lesser alar cartilage. The lesser alar cartilage is U-shaped and it consists of a medial crus and a lateral crus. What we can see clearly in this picture is the lateral crus. This is the lateral crus. And extending into the midline is the medial crus. The medial crus forms the columella of the nose. And the lateral crus articulates with the upper lateral cartilage above. And it also forms the lower border of the Lyman nasi internally. And lying lateral and above to the alar cartilage is the lesser alar cartilage. Lesser alar cartilages could be 2 or more in number. And these are present, it's a small structure present laterally and above the lesser alar cartilage. Now what is to be observed here is most of the free margin of the nose is formed of fibrofatty tissue. There is a small contribution from alar cartilage, but most of it is formed by fibrofatty tissue. All this is the fibrofatty tissue. This is the fibrofatty tissue that is forming the free border of the nostril. With this, we complete the framework of the nose. Upper 1/3 is bony and lower 2/3 is cartilaginous and all these structures. Next, this is another clear picture showing the cartilages from the inferior view. You can identify this as the alar cartilage which is U-shaped. This is the U. And what you see here, this is the lateral crus and this is the medial crus. And all this is the fibro-fatty tissue that is forming the free border of the anterior nares or nostrils. The medial crus forms the columella of the nose and the lateral crus overlaps with the lower border of the upper lateral cartilage. This is the lateral crus and it is overlapping with the lower border of upper lateral cartilage. This osteocartilaginous framework is covered by skin and muscles. So let us see what are the muscles present on the nose. Small certain movements are possible in the nose also. Although nose is not very much used in facial expressions or for any other movements, but still muscles are present on the nose and they facilitate movement of the nares and movement of the entire nose. So let me list out the nasal musculature. The first muscle is procerus. Next is the nasalis. Anterior and posterior dilator nares. They dilate the nostril and there are two of them, anterior and posterior dilator nares. And we also have a muscle known as depressor septi. And also another muscle called as levator labii superioris alac nasi. All in all, the muscles of the nose are not very important. A few of them are rudimentary, few of them perform some function, but not very important as such. But they are all supplied by facial nerve. All these muscles are supplied by facial nerve. So first is the osteocartilaginous framework and on top of that is the musculature and finally we have the skin. And next is the nasal skin. On top of the muscles is the nasal skin and the skin covering the bony part is thin and freely mobile. You can just observe by pinching the nose. This part, the skin over that part is thin and it is freely mobile, whereas the skin covering the cartilages, the lower part of the nose, is thick and it is adherent. And it also contains many sebaceous glands. Skin covering the upper 1/3 or the bony part is thin and freely mobile. Whereas that covering the lower 2/3 is thick and adherent. And also it consists many sebaceous glands. So usually acne on the nose are seen in this area because there are more sebaceous glands. Also there is a condition called as potato nose where these sebaceous glands undergo hypertrophy. Anyway, let us learn about all the disorders affecting the external nose in the next video. This is all about the anatomy of the nose and a quick recap and revision. External nose is a pyramidal structure and the top part of it that connects the external nose to the forehead is called the root of the nose. And the base of this pyramid, the base of the nose consists of two openings called as anterior nares or nostrils. And the osteocartilaginous framework consists of upper bony part, that is 1/3, and the lower 2/3 is cartilaginous. It is mainly made up, the bony part is mainly made up of paired nasal bones which are supported by the maxilla and by the frontal bone. And cartilages, there are 4 cartilages, 3 of them are paired And the three paired cartilages are upper lateral, lower lateral and lesser alar cartilage. And the single unpaired cartilage in the midline is septal cartilage. An important point to be noted is, internally, the lower border of upper lateral cartilage forms a structure that is known as nasal valve or Lyman nasi or Lyman vestibule. Its clinical importance will be consequently understood in further classes. And this is a picture showing the two nasal bones and how the maxilla and frontal bone are supporting them, and the cartilages of the nose are also shown here. The upper lateral cartilage. This is the upper lateral cartilage. This is the lower lateral or alar cartilage, and this is the lesser alar cartilage and fibrofatty tissue with the septal cartilage in the midline. Another interesting point that can be observed here is a bonus point. At the junction of bone and cartilage, this point of the nose is called as rhinion. That point between the bony and cartilaginous part of external nose is called as rhinion. Just like how this is the root of the nose, that is another landmark. Rhinion and root of the nose. Next, this is a picture showing the alar cartilage in much more detail with the lateral cross and medial cross properly seen and also the fibrofatty tissue. Then muscles of the nose are rudimentary, or they have some minor function in facial expression and in inhalation and exhalation process, and they are procerus, nasalis, anterior and posterior dilator nares, depressor septi, levator labii superioris alac nasi, and all of them are supplied by facial nerve. Then on top of the muscles, a muscular layer, we have the skin covering this entire structure, and the skin on the bony part is thin and freely mobile, freely movable. The skin covering the cartilaginous part of the external nose is thick and it is adherent, and also it contains many sebaceous glands. So this is all about the anatomy of external nose. Thank you very much.